Welcome back, everyone. It's just about 1:45 right now, and there is major talk today about a federal vaccine advisory committee voting to end the long-standing recommendation that all babies born in the U.S. must get a hepatitis B vaccine on the day that they are born. Dr. David Nguyen is a pediatric and adult infectious disease physician who is joining me now to talk more about the new recommendations here and just kind of the overall confusion, quite honestly, that a lot of parents are going through right now.
Yes, you use. Thanks for having me, by the way. That you used the perfect word there, confusion, and that is a really big concern of mine with this committee's recommendation, which is not based in any kind of evidence, nor is it even centered around a real clinical question, which is usually how these are supposed to go. It's simply put out there and not based in any evidence, and I think tragically harmed the uh, legitimacy, I think, of recommendations that come out of this committee.
What is the importance of the hepatitis B vaccine at that stage of life specifically?
Yeah, that's a great question. This is one I love answering because, this committee and the folks who want to change the vaccine schedules like this are all they always say that they want us parents to have all the information. Well, I'm going to give you the information right now. Hepatitis B is a very contagious disease. It's a viral infection. For if an older kid or you or I were to be infected, we may do okay with it, and it's while still very infectious, we may survive with it all right. But a baby in the newborn period, and very young, first couple months of life, 90 to 100% chance they will go on to have an infection, which can lead to liver failure, liver cancer, and possibly even death.
So they recommend that the birth dose will only be for babies whose mothers test positive and in cases where the mom wasn't tested. Your thoughts on that?
Yeah, to me, that's playing with fire, basically. And what I like to say about that is, if you're preventing a fire for your home, if you want to prevent fires for your home, you wouldn't rely on just one fire extinguisher. You would make sure that you've got fire alarms, fireproof things that are necessary, remove hazards from around your home, things like that. And to me, limiting the vaccination to those situations, like you said, it's going to miss cases of, while rare, I will admit that rare, but highly consequential, as I just outlined, if a baby gets hepatitis B, again, resulting in liver failure, cancer, and potentially death, usually before the ages of 8 to 10.
Is this the first time that this vaccine has been questioned to this level?
It's the first time it's been questioned like this, which is, as I said, isn't really centered around a clinical question, and it seems to be more motivated by someone trying to set an agenda to fit what they don't think is necessary for protecting children. But the first time to go back in the history of things, before we had this recommendation, they created the hepatitis B vaccine and did try and start only vaccinating people that they thought were at risk, and mostly adults. And the important thing of that, they gave it a solid 10 years or so, and the CDC that is, and the incidence of hepatitis B in this country did not change, and most importantly, it wasn't moving the needle on the number of children with hepatitis B. And as I already outlined, why that's so important and morbid and fatal for that population. So, at some time during that point, they did institute the universal screening of pregnant women, and then a few years after that, they it recommended the universal newborn hepatitis B vaccine. And since that recommendation, it's virtually unseen through most of the population. in children.
Sort of like a few other things that we've recently had a reversal on, that had essentially eradicated some things that we're now starting to see in communities.
Yeah, I mean, I'm guessing you might be alluding to the measles
Correct.
of recently. Yeah,
Correct.
so yeah, that's another tragedy. Measles had what we call an elimination status about 20 or so years ago, and what that means is that that you don't have within country endemic spread for a certain amount of time of that disease, and so like since that declaration, most of the measles cases in the United States have been linked to a transmission of measles from people coming from areas with measles, like in outside the United States, including Europe. But as we have seen tragically, there's been the largest outbreak of measles in this country, mostly in Texas and New Mexico, and I mean, and then that's gonna our elimination status will be threatened for that, and I honestly wouldn't be surprised if we lose that.
So, in their, it seems as though from this advisory panel, their outlook on it is to give parents the power to choose. Similar to like measles, many of the communities where we saw measles outbreaks in the last several months have been very religious communities that are against these types of vaccines.
Yeah. Well, to that I say, if they really wanted to let parents choose, then they would have it be available, and continue to let them speak with physicians. Physicians are going to always talk about, especially pediatricians are always going to talk with families about vaccines, and should welcome if there are any questions. We want people to be on board and understanding why this is important, and the we can provide that information. We have been providing that information to families. I've been doing it my entire career, and they say that they want it, to empower families, and give them more information and more freedom. But what I see is seems like it's going to have the opposite effect. And for right now, there may not be any issues with access to the vaccines, but when regulators, insurance companies, people look at what are we going to stock, what are we going to cover, they may cite, faulty recommendations like these, to not do and take these measures to help protect children.
Yeah, I
And
guess.
so that therefore limit its access and freedom to make those choices.
Yeah, that was a similar conversation the last time there was a reversal that, okay, well, I mean, even if you say you're leaving it up to parents, well, health insurance companies kind of come behind and say, well, if it's not mandatory, then we don't have to cover it.
And I mean, to my knowledge, that hasn't happened yet, and I hope it stays that way. And I know a lot of states, including Illinois, are taking steps to ensure that that there are something that says that we follow the evidence to support that these are important measures to protect children. These vaccines, including the hepatitis B vaccine at birth. And but it's creating confusion, like we started off at the beginning of our conversation. Those mixed messages. It's just really tragic to see that kind of confusion be sown there.
Yeah, and of course, the CDC currently has no director because the acting director left already. And then Health and Human Services Secretary Kennedy fired the entire 17-member panel earlier this year and replaced it with a group that it does include several anti-vaccine voices. It is a challenging time, but I hope that you continue to advise your patients in the best way possible. Thank you so much for your time today.
Thank you. My commitment will always be to patients and their health, the health of children, as I know that is definitely the commitment of my colleagues at Rush and all over the country, really. It is challenging, but we're going to keep working for our patients and our families.
Dr. Nguyen, we appreciate it. Thank you so much for your time.
Thank you.
All right. Well, about 1:55 right now. We'll be right back.